Do you work in health or social services? Are you based in a care home, a hospital, a doctor's surgery or an office? Are you a receptionist, a psychiatrist, a porter or a cook? Maybe you're a nurse, a social worker, a gardener or an occupational therapist. This resource helps all of you to recognise and develop the skills and values you need to support people with dementia and their families and carers. It helps you to understand more about dementia and to think differently about the people with dementia you might work with. It might be while they're attending an appointment, living in a care home, living in their own home, or in a hospital ward. People with dementia have rights and abilities, rich histories and experience. All of this must be recognised as we care for and support the people we meet in our different roles. As people live longer, there are more and more people living with dementia in Scotland. Dementia affects about 2% of people aged 65 to 70, 5% of people aged 70 to 80, 20% of people over 80, and currently 82,000 people in Scotland. That figure is expected to double over the next 25 years. Dementia is not just a condition affecting older people. People in their 40s or 50s or even younger can have dementia, and it is sometimes only one of a range of conditions people may be living with. For example, dementia and depression, dementia and learning disability, dementia and heart disease. We need to develop new approaches to how we offer information, care and support, and that goes for the families, friends and neighbours of people with dementia too. They need support to help people with dementia have the best quality of life as they journey through their illness. Wider communities also have a role in keeping people with dementia connected to the life and activities they value. We're all part of communities, and our lives will be increasingly affected by dementia, at a personal level, in our work settings, and among our families and communities. In June 2010, the Scottish Government launched Scotland's National Dementia Strategy, which set out a range of commitments in relation to dementia care, support and education. 1 year later, in June 2011, the Scottish Government launched Promoting Excellence, a framework for all health and social services staff working with people with dementia, their families and carers. At the same time, they launched Standards for Dementia Care in Scotland. Promoting Excellence describes the minimum knowledge and skills required by all health and social services staff, whether you work in a care home as a cook or a gardener, whether you're a receptionist in a clinic, or whether you work in someone's own home. Some staff, such as social workers and nurses working with adults in the community or on acute hospital wards, will need more detailed knowledge and skills. Others, such as pharmacists, consultant psychiatrists and mental health officers, will need very detailed knowledge in relation to their specialist areas of work. But all their training and learning will build from the information, aspiration and principles outlined in this resource. The standards outline what people can expect from the services they receive. So together, these documents represent a means of making sure that improving quality of life for people with dementia is at the heart of what we do. How can we use this resource? We want you to use this resource in the way that best suits your preferred way of learning. You can use the resource as an individual, a team, or as an organisation. You can focus on one chapter at a time, discussing the questions posed with your colleagues, or reflect on them in your own time. You can confirm your progress against the key learning points at the end of each chapter, and check out the links to other resources to enhance your development. The scenarios throughout this resource show people who are working in situations you might recognise from your own experience. Although we've not based the scenarios on the experiences of any real individuals, we think they illustrate practice that does exist. We want to show you how these situations can be dramatically transformed for people with dementia, often with little change in our behaviour. All of us can do our work just a bit better if we think about what we're doing, develop our knowledge and skills, and focus on who we are actually working for. We're working together to improve quality of life for people with dementia. Dementia is a journey, and it's a journey you can influence. We're all able to make a difference. People living with dementia can best describe how important our work is. Here's what someone living with dementia has to tell us.
What I would say to the professionals is that you can pull me back, give me my life back and pull me into the light. And by the same token, ignorance, arrogance, couldn't care less, you can shove me down into the darkness and just cast me away. I can't do it. I need your help to do it.
So what are the key learning points from this chapter? Dementia affects a large and increasing number of people in Scotland. Dementia affects a range of age groups and can occur alongside other health problems. Dementia is everyone's responsibility in health, social services and communities.